three of these things. On the road, that's a new topic with this increase in truck driving and transportation of goods on the streets, on the roads. They've been doing simulated driving, and they put everybody with sleep disorder breathing, like all type of disorder breathing. People with any of those, sleep apnea included, they were 100 times more likely to go off the road. I always fascinated when I drive on the highway, I see some trucks, whoops, they go somewhere on the side of the road. Could happen because of these. And actually, right now it's mandated in order for them to have the licensure to get a sleep study performed. If they don't have a sleep study, their professional driving license is not renewed. Or if they have it, they need to carry their CPAP machine, their treatment. Because of these, they have a 7 times increased risk of accident. And the one that is a little bit on the funny side, 9 out of 10 police officers that are stopping because they think, oh, you've been driving weird, or they see a pattern, usually because they think, oh, you've been drinking. But then they find out 9 out of 10 times he's not drinking, it was what?
Not sleep.
Not sleep apnea. They were really tired. They were really fatigued. They've been dozing. Okay, so this could happen because of sleep apnea. Who knows? So we're approaching the halftime, so we need to raise the spirit a little bit. Yeah, so it's a big thing also in terms of commercial driving. So keep it away. Yeah, it's bad. We know it's going to cause so many problems. But we have such an easy treatment. It's not, let me reformulate. It's not like an easy treatment, but it's so effective. Just by wearing the CPAP mask, the nasal continuous positive airway pressure, you abolish the disease. You tell me another treatment for any type of disease that I give you this treatment, you're cured. That's how this works. You have it, done. You don't have sleep apnea anymore. Then you have some other type of treatment, behavioral therapy, especially in those mild cases. All of the other treatment can work, like behavioral therapy. We can go another 2 hours to let's not eat 2 hours before going to bed. Let's not drink a couple of hours before going to bed. Let's keep the bed just for sleeping. Let's not watch TV in bed. Let's not be in front of a computer an hour before bed. And I can go on and on and on. Okay, that's the part of behavioral. Then you can have oral appliances, mandibular advancements, for those cases in which I said the anatomy of the throat is abnormal. So there are a lot of gruesome surgeries that can happen to open up this airway. Surgical reduction of the airway soft tissue. When you have too much, oh, let's cut some pieces. So we clear that area. And always, the good old diet and exercise helps too. Especially if you're obese, let's lose some weight, and that can help. And I'll show you some statistics later on about this one. This is the mask that you've been hearing about, people getting it. In order to understand what happens,
provide a gentle stream of air through a nasal mask to keep the airway open during sleep.
You saw there was, so we can see it. There's the mask that will send a stream of air to keep this area open. This is the continuous airway pressure. So I need some splint, it's like pneumatic splint, to send it in to keep it open. Because otherwise, how do I keep it open? Prop it open with a piece of wood or something here. So they come up with this thing. This sends air all the time to keep it open. That's why sometimes this dries the throat or causes some pain, irritation, because always the current of air is going through. Okay? An alternative can be a bypass, like in terms of continuous send, let's send now and later, so I can breathe out, breathe in. Because when this air comes in, you have to breathe out. And you're breathing out against the air that comes in. So sometimes it's difficult. So this is what helps. Look, this is open now. It's not going to close. So no sleep apnea. No obstructive sleep apnea anymore. So no changes in blood pressure, oxygen, heart rate, and anything. So that has been shown to work the best. Going back to the blood pressure, since hypertension is the first thing that happens and can trigger all these cardiovascular issues, doing CPAP treatment, using the mask, helps with systolic blood pressure. They showed you got people with hypertension, they put them on CPAP, short term, a month, 2 months, or 2-3 years, and they saw the systolic blood pressure going down, 20 millimeters, 30 millimeters. Depends on the severity and also the adherence to the treatment, because that's the best and the hardest part. To use your mask, to use the treatment. In order to be efficient, that mask has to be worn at least 4 hours a night for at least 90% in the first 3 months or something, in order to get benefits. So you have to wear it. You have to use it. And sometimes Medicare, Medicaid is helping for these for free if you are adherent. Yes?
Now, they told me that I use mine at least 80%. And at first I thought I would never be able to sleep with that. Now I have difficulty sleeping if I don't wear it. I've gotten so used to it.
Yeah. That's the hardest part, and I'm hearing it from the patient to start. It's something uncomfortable, and I'll have some pictures with the mask, because they're different masks. Some cover just the nose, just the mouth, both the whole face, and so forth. That's the first thing that everybody's complaining. It's something new: claustrophobia, dryness, irritation. I don't like it. The masks are getting better and better in terms of humidification, in terms of moisturizing. So they're getting better now in the construction. But people have to use it. Otherwise, the treatment is not there. So you've been saying, I have sleep apnea, I was prescribed treatment, but nothing works. Yeah, but are you wearing it? Are you using it at night? Oh yeah, I use it. For how long? I use it every night. Oh, like an hour, and then I threw it off because, okay, this is it. So you never know. Look at the example with 3 or more antihypertensive medications. By using CPAP, you can get off of some of those medications. Also, your blood pressure goes down. Another technology is the positioning. So if you go to the sleep clinic and they find out you most likely have the sleep apnea when you sleep on your back, so you're just positioning, but when you sleep on your stomach or lateral, you don't have sleep apnea, they say, okay, let's make you sleep just on your side or on your stomach. So they created, if you look a little bit here, those are like tennis balls inserted on your back. So you can't be on your back because you'll feel like, oh, I have to turn. And there's some other methods, they put like some collars, and as soon as they find out, they not shock you, but they vibrate a little bit because they don't want you to wake up during the night. They don't want to do that.
Tie you down?
Yeah. So there's some other technologies to avoid this positioning.
Body pillows work great.
Those two, yes. Weight loss remain a highly effective method. And you can see 10, 15, let's say, somebody with 300 pounds, you lose 30 pounds, you can see a 50% reduction in sleep severity. So if your AHI, that severity was, let's say 40 times an hour, by losing 10% of your weight, you can go to 20, 40 to 20, or 10, from 20 to 10, or from 100 to 50. But you have to lose some weight. Now also, pulmonary rehab helps with sleep in general in COPD patients. In terms of quantity and quality of sleep, just by doing, and when I talk about pulmonary rehab, you understand it's still exercise. That's what you do in those pulmonary programs. You exercise, yeah, you get some information about educational topics, nutrition, stress management, and all that. But exercise portion of this helps with the quality of sleep. Always, it's good. Even in severe COPD, 8 weeks of pulmonary rehab, so 2 months of pulmonary rehab helps with sleep. The most severe one, I'm talking about gold stages, gold stages COPD, the one level 4, which is the one with the VE less than 30%, which is really low. Even in those patients, some kind of pulmonary rehab helps with the sleep.
Adrian, this hospital pulmonary rehab is done differently than any other hospital in our region, in that she will not accept insurance.
Okay, that's good.
Charges everybody $5
Just to be.
and I've been in the program for 12 years.
Yeah.
So there's no more of this insurance kicking you out after 90 days.
Yes. But you can see the other benefit, not just
Absolutely.
keeping the functional level of your body, but also sleep. That helps with sleep, being part of an exercise program. How do we know if somebody has sleep apnea? This is the gold standard, polysomnography. This is the test. It's using all these measurements because you have wires all over, because they need to understand brain waves, they need to understand muscle activity on the arms, legs, they need to know respiration, they need to know movement of your eyes. There are a lot of things, and you look like this, tell me if I'm not wrong, you have all this. So a lot of people feel like, oh, should I go through this? That's the gold standard. That's how I know you have it or not. That's how I know the severity. Okay, you all here, I have to treat you differently than somebody who just have a little bit. Or you might have something else, not sleep apnea. Because like I said, there are like so many other conditions that happens during sleep. That's why they come up with those at-home devices. So there are little devices you take home with you to get, at least you get screened. And they're pretty accurate. I give you this device, it's more like a PDA, it's a belt, you put it around your chest, and then you attach one pulse oximetry on your finger, then you put a nasal cannula to measure the oxygen level, and you're good to go. You sleep with that thing. This is in your home, in your environment, and very accurately, if this machine is telling you your AHI, your severity was 50, probably it's underscoring a little bit. But it's right there. I know for a fact that, and the sleep physician is doing that, take this one home with you. I don't have 6 months to wait for you to get diagnosed. Take this one home, wear it at home, and we'll see. If you're really severe, okay, let me see what I can do for you.